Hello everyone, welcome to the Medic World Study with Dr. Mahi. Today we'll discuss the previous year questions of NEET PG 2020 of the subject Anatomy. So our first question, which of the following forms the lateral boundary of anatomical snuff box? We all know that the lateral boundary of anatomical snuff box is formed by two tendons, that is abductor pollicis longus and extensor pollicis brevis. Let's see the options. The first option is extensor pollicis brevis and abductor pollicis longus. So it is the answer, that is A. Now the next question. Identify the cell marked in the histological image of the cerebellum shown below. Let's see the image. Here the image is shown below and the cell which is marked here is the Purkinje cells. Now how can we identify the cell? Because Purkinje cells are flask-shaped cells and the cells are evenly spaced and arranged in a single layer, and the dendrites arise from the neck of each flask-shaped cells, which passes upwards to enter the molecular layer, which then branches extensively to form the dendritic tree. So the answer is option A, that is Purkinje cells. Now, next question. Which of the following is not used for the identification of facial nerve trunk? Let's see the options. Retrograde dissection of distal branch. Yeah, it is used for the identification of facial nerve trunk. Tragal pointer. Yeah, it is also used as a method. Inferior belly of omohyoid. No, it is not used. And posterior belly of digastric, it is used. So the answer to this question is option C, because here it is asked not used for the identification of facial nerve trunk. Now the next question, the false statement about fetal circulation. False statement is asked. Let's read the statements. Anatomical closure of foramen ovale is by 3 to 5 days. No, it is the false statement. We all know the mnemonic. That is FA. Ductus venosus, A for arteriosus, and O for ovale. And the anatomical closure of these structures are like this: V 1 week, A 2 week, and O 1 year. And here it is given the anatomical closure of ovale is by 3 to 5 days. No. Now anatomical closure of ductus venosus is 3 to 7 days. 1 week, 3 to 7 days. Yeah, it is the true statement. Right umbilical vein is absent. It is the true statement because left is left. We all know this mnemonic. Now, the last statement, anatomical closure of ductus arteriosus is by 2 to 3 weeks. Arteriosus 2 to 3 weeks. It is the true statement. Now the answer is option A. Next question. A tumor of the uncinate process of the pancreas affect which of the following vessels? The options are superior mesenteric artery, portal vein, common hepatic artery, and inferior mesenteric artery. Here the answer is A, that is superior mesenteric artery. Why? Because it arises from the abdominal aorta and it lies first behind the body of pancreas and then in front of the uncinate process. So any tumor of the uncinate process of pancreas will affect the superior mesenteric artery because it lies in front of the uncinate process. Now the next question. A patient presented with clinical features of ataxia and incoordination. That means there is a lesion or problem in the cerebellum. This is due to the thrombosis of which artery? Any artery supplying the cerebellum, thrombosis in any of the arteries can cause ataxia and incoordination. So the answer to this question is option D, that is superior cerebellar artery. Now the next question, which of the following structures prevents the upward extension of the thyroid swelling through its attachment to the thyroid cartilage? We all know that sternothyroid and sternohyoid prevent the upward extension of thyroid swelling through its attachment to thyroid cartilage. So the answer to this question is option B, that is sternothyroid. Now the next question. A patient presented with extension at MCP joint and flexion at interphalangeal joint, which muscle is affected? We all know that flexion at MCP joint and extension at IP joint. Interphalangeal joint extension and MCP flexion is done by lumbricals. And in the case given above, there is extension at MCP and flexion at IP, means this function is damaged. That means the muscle which is affected is the lumbricals. Let's see the options. So the answer to this question is option B, that is interossei and lumbricals are affected in this case. Now the next question, meiosis occurs in. Let's see the options: adrenal, adult ovary, prepubertal testis, and hypothalamus. Meiosis occurs in adult ovary because meiosis takes place only in germ cells, which results in the formation of haploid gametes. Meiosis requires two cell divisions. So the answer is option B, that is adult ovaries. Now the next question. The long left recurrent laryngeal nerve is due to the persistence of which left artery? Long left recurrent laryngeal nerve. Due to the persistence of left sixth arch artery, the left recurrent laryngeal nerve is the longer one. So the answer is option B, that is sixth arch artery. Now the next question, the muscle marked by the arrow in the given image below is innervated by the. First of all, we have to identify the muscle here. The muscle which is marked by the arrow is the levator scapulae muscle. And it is supplied by which nerve? We all know it is supplied by dorsal scapular nerve. So the answer is option A. Now the next question. A patient presented with weakness of the right side of the face with loss of pain and temperature. Pain and temperature sensation of the left leg is also lost. The lesion is most likely located as per the symptoms given below: weakness of the right side of face and loss of pain and temperature, and pain and temperature is also lost on the left leg. These all points towards the diagnosis of lateral pontile syndrome. So the answer to this question is option B, that is lateral pons. Now the next question. Ligation of common hepatic artery will impair blood supply in. So we have to learn the branches of common hepatic artery first, because ligation of this artery can hamper the blood supply of its branches. So the branches of common hepatic artery are right gastric and right gastroepiploic artery. Now, the answer to this question is option A, that is right gastric and right gastroepiploid artery. Now, the next question. The type of joint marked in the image below is. First of all, we have to identify the joint. The joint which is marked in the image is the costotransverse joint, and it is a type of synovial joint. Let's see the options. Syndesmosis, no. Synarthrosis, no. Synchondrosis, no. The option is synovial joint. Answer is synovial joint. Now the next question. Identify the sign shown in the image below. We have to see the image. In the image, we can see a bulge here in the biceps tendon, and it is the rupture of biceps tendon, which is known as Popeye sign. Let's see the options. The answer is option A, that is Popeye sign. Now the next question. A patient presented with enlarged inguinal lymph node, the most likely primary cause is. The most likely primary cause of an enlarged inguinal lymph node is anal cancer. So the answer is option B. Now the next question. Identify the type of cartilage shown in the image below. Here in the image, we can identify this cartilage as the elastic cartilage. So the answer to this question is option B, that is elastic cartilage. Thank you so much.